Delirium is a very important thing in acute care hospitals. Delirium is a state of sudden acute confusion that usually takes place in older adults who are admitted to hospital with medical conditions that make them acutely unwell. Delirium is bad. It's common, it's costly, and it kills. The length of stays can double. They're very muddled up, very confused. They don't know quite where they are. They don't quite know when they are. They may be thinking they're at home still or in a hotel or any place except in a hospital. They may be incoherent in how they speak. They may be quite mixed up, maybe quite scared or angry or fretful or teary. It's a great pretender. You look like a bit of everything and anything. And for a patient who has it, it's like a living nightmare. They're scared, they're frightened. They may act out on those frights, not intending to hurt anyone, but may lash out. Or they may be extra sleepy and not wake up or fall asleep during your examination. It looks like all those things, and it fluctuates in arousal and attention over a span of minutes.
And I moved around to different candles, and then the candles start to light my bedclothes on fire. And I start calling out to get help. That was the scary part because I could smell the candles, but I could smell my bedclothes. It wasn't like there were flames coming up and engulfing me, but I could smell the bedclothes burning. I felt as if things were happening that I had no control over, and it was very frightening. And I wasn't sure whether it was real or they were barbecuing people or whatever. Those things were crossing my mind. And I don't remember particularly asking anybody to help me. I remember by that time there didn't seem to be any interest in helping me, and I was just there. Right now I think I have it pretty clear in my head that what was real and what wasn't real, but there was a time afterwards when I was still trying to sort things out. There was a time for several days when I was trying to think, did that really happen or did it not? And it's not the easiest thing to do.
There are programs, there's like hospital programs. The Hospital Elder Life Program is a program using volunteers in a structured way to help individuals who are at risk of delirium, older individuals, older persons who are frail physically or cognitively, and doing things like making sure that they're sleeping better, making sure they're stimulated in the daytime, making sure that these individuals have glasses that are clean and hearing aids that are working with. And by doing this, it seems kind of simple. You can reduce delirium by up to 30% in persons who are at risk using this multimodal approach.
Well, the objective of HELP is to prevent the onset of delirium. So our roles as volunteers are multifaceted surrounding this objective. So not only are we providing companionship for the patient, but we are doing things beyond this as well. We are gently orienting them to person, place, and time. We fulfill set interventions that are provided in the patient's profile. And we also do meal assistance, which is so important. Dehydration, lack of nutrition can also contribute to delirium as well. And we also do range of motion exercises with these patients.
You don't allow people to be a bed bug. You want to get them out of bed, at least in a chair. And if you can get up from a chair to walk, especially during the weekends when there's fewer staff to do that, family can help in this process. So too can friends and neighbors who are knowing what to do and need to be allowed to do these things to help out their friends and their family. You systematically use the confusion assessment method. Is there a sudden change for the worse in your patient with fluctuations? Is there change in attention? Is there more disorientation? And is a person extra sleepy or not sleeping at all? And if you have all those features, that person is more likely to be confused, what we call delirium. And if that's the case, you want to get on top of it as soon as possible. A person who is already, say, having a dementia from a nursing home, it may be hard in some ways to tell, but in other ways it's not. If there's a change in their customary habits, if they're able to do things like brush their teeth or wash their face before, and they can't do that now, and they're very muddled up, mixed up, that's not an acceleration of their dementia. They're likely sick. There's something going on, and that sickness is manifesting as their brain becoming confused, what we call delirium.
So it was actually kind of difficult initially for me to determine whether or not my patient had delirium. Initially, the CAM assessment, which assesses for acute delirium, all of the results were saying that my patient was not delirious. But I was noticing that his stories were unrelated. They weren't making any sense. He just was going off about stuff that clearly wasn't happening. He was having some auditory hallucinations as well. So and as the night went on, I noticed that his symptoms were getting a lot worse. I kept redoing my CAM assessment, and it did eventually trigger that I did have a CAM, so a positive CAM. So that really helped me to talk to doctors as well about that, because I was explaining to them that there's something off about this patient, but they didn't understand the terminology. As soon as I used that, my patient was CAM positive. The doctors came on board, they came up, they assessed the patient. We used the delirium order set. I initiated that right away with the physicians, and it was all in place.
They've never seen their family members shouting or scared or frightened or up at night or bed exiting or swinging at staff or trying just to keep them clean. Education is the key, reassurance, this will pass.
I had a niece do a timeline, but she did a timeline for me and sent it to me, and this happened this day, this happened this day, this happened this day. And she did that a few weeks afterwards. But boy, that helped me sort things out. So maybe that helps if that happens even after you're out of the delirium.
Yes.
If somebody sits down with you and says, you know, this happened, and do you remember this? And if I say, no, I don't remember that, then they can maybe help me sort it out.
Nothing has been shown better over the last 20 to 30 years than the principles used by the hospital elder life programs. These teams make use of multimodal approaches. They make use of different levels of expertise to lower that risk as much as possible.